The project is a 4-year project. It's really to improve and to build on what we currently have existing and to develop the areas that we do not have existing. So we do not have, at the moment, we do not have emergency medical technicians nor paramedics in St. Vincent. So this would be a first for us. We will train some seed instructors. That means they go off to Taiwan, they do the program, we get a syllabus, and then it would be taught at one of our institutions here, whether that's a medical school or whether that's community college, right? So it would be taught here, so it would build capacity in country. It also means then that later on, what obtains now, which is that a nurse goes off on the ambulance or a doctor and a nurse goes on the ambulance, response would now be our EMTs that are trained to provide intervention in the field, which would improve the outcome. So doctor and nurse stays at A&E, the EMT goes out and intervenes and then comes to A&E, brings the patient to A&E.
Essentially, I've always been interested in life support measures, the critically ill patient, identifying that patient, and assisting as much as possible to give that patient the best chance of life and survival so that they themselves can spend more time with their families. Okay, so this is extremely beneficial because one of the core things for the emergency department is for the individual to be able to identify that critically ill patient, and in the event that someone experiences or has a cardiac arrest, for you to be able to render the best care possible to resuscitate that patient so that that patient has the best chance of survival.
I did a number of training, including mass casualty management, where I'm now the instructor as a mass casualty management instructor. And going on forward, we were selected to do this training in Taiwan, which will make us instructors, and we will come back and make our team bigger. So we don't have a lot of medic trained, even at the airport and at the hospital. So this training will enhance us to be instructors and train more persons, so we'll have a lot more people to respond to any emergencies.